Ed Williams is the director of Alachua County's Animal Services Department. He's a graduate of Georgia Tech with a BS in architecture, and he owned and managed a small design firm. Ed began his involvement in animal services by serving on the board of a local nonprofit humane society. 5 years later, 4 in which he served as the board president, he took over at a time of crisis as executive director to run the day-to-day operations of that organization. He served in that position for 6 years before coming to Alachua County 2.5 years ago. In his former position, he was able to increase the live release rate by over 150% and decreased euthanasia to the lowest levels in organization history. With the help of his staff, he implemented biosecurity protocols throughout the shelter and strengthened vaccination standards to improve animal health and reduce the spread of contagious diseases. Ed is currently a member of the Association for Animal Welfare Advancement and the Florida Animal Control Association. Welcome, Ed.
Thank you.
So you've been here for 2.5 years. I thought it was high time to get you on the show and introduce you to the community. Let's kind of start with the basics of animal services, and I guess it all kind of starts with animals coming into the shelter. So tell us about stray animals. Where do they come from? What do you do when they get there?
All right. So approximately 80% of our intake of animals are strays. It's fairly evenly split between what comes in over the counter versus what officers bring in off the road. About 55% of those, plus or minus, are dogs, and about 45% cats.
Let me just butt in for just a second.
Okay.
Over the counter, that's, I know there's an acronym, OTC. Does that mean people that have found pets and brought them in, or people surrendering their own pets?
No, that's just citizens bringing in strays that they found.
And about 80% come from that and your officers?
Yeah.
Okay.
Yeah.
All right.
Definitely.
And so I'm sorry, I interrupted you. Go on.
That's all right. A lot of people ask, what do you do when you find a stray pet? Our shelter hours, the Animal Services is kind of a 24/7, 365-day-a-year operation, but the shelter is actually open to the public Tuesday through Saturday, 10:30 to 5:30, so they can certainly drop off then. And we always have officers that are on call or on standby after hours. Certainly, and of course you could reach the on-call officers by calling 911 emergency. The non-emergency number is 955-1818, and tell them that you have an animal-related situation. We now get text messages from the 911 center every time there's an animal-related call in Alachua County.
So obviously, if it's a situation where there's some danger or an aggressive animal, you call 911, call the 955-1818 number if it's just a dog or a cat on the loose.
Right, right. Yeah. Particularly, I guess more of an emergency type situation would be if a dog or cat can do it too, or acting aggressive towards someone, or also if they're injured, and officers will respond and pick it up, and then we have contracts with after-hours emergency veterinary clinics so that we can take it and get it some care. We do ask that people refrain from bringing us animals that they found in other counties, just because it's a whole lot less likely that the animal's ever going to be reclaimed by its owner. And sometimes, people sort of make the judgment that they picked up an animal, it looked like it was in pretty poor shape, so obviously nobody owns this, so it doesn't really matter, but it could have been their beloved pet that's been, slipped out the back door when the child left the door open or something like that, and it could have been on the run for a couple months. We have reunited people with their animals that have gone missing for, as much as a year or more away from each other, yeah. So,
now, does every county have an animal services department, or is that handled differently depending on the county?
It's handled differently depending on the county, but every county should have some form of animal services.
Be it a government organization or a nonprofit? Or
Right.
Okay.
And people are just way more likely to go. I mean, you're not going to go to the shelter, the county shelter 3 counties over to look for your lost pet. So we ask people to please take them to their county. And we also ask people to please avoid taking the animals to a veterinary clinic, veterinary practice, particularly when Animal Services is open during the weekdays, and also you know, it sort of clogs up the system for that veterinary clinic. They've got emergency cases to see, so unless the animal is injured, we ask that you please contact us instead. And also, kind of a big one is try to avoid taking nursing kittens away from their mother. That's a pretty timely issue right now, spring and summer. A lot of kittens, particularly in north central Florida, kittens can have, or cats can have about 3 litters a year. So we would like people to try to avoid taking away the nursing kittens. A lot of times mom is moving them, or she's out hunting for food or something like that, and she'll be back. So don't just, I think what we have a little poster that says don't catnap the kittens. It's kind of a cute play on words, but essentially, you know, wait for a couple hours, look and see if the mother doesn't come back before you take the kittens. We can do a lot of things at the shelter, but nursing baby kittens is really challenging, really time intensive, and they really stand a much better chance with their mother than they do at an animal shelter.
And I'm sure we'll talk more about feral cats and kind of how they're handled in the county, but tell me a little bit more about owner surrenders that are over the counter. What percentage of your intakes does that fall into?
Yeah, owner surrenders over the counter is about 17% of our intakes. Actually, I think owner surrenders, not just over the counter, but all total are about 17%, probably about 12% over the counter and 5% from the field, from the officers. We are now accepting owner surrenders by appointment only, except in cases of emergency. And that is just in an effort to give us a chance to talk to the citizen, try to see if there's another solution that we can come up with besides just the animal coming to the shelter. You know, for too long in our society, I think people have thought the animal shelter should be the first stop when they want to dispose of an animal, and really, you know, we like to see it be the last stop, and we'd like to try to work with them on a one-on-one basis to see if there's a way that we can help them keep the animal in the home. Perhaps there's a behavioral issue, or perhaps they're struggling, you know, providing food, and they just have a temporary need that needs to be met, and they would really love to keep their beloved pet. And we can help, you know, put them together with a good behaviorist. We could give them some free food if it's, you know, just needed for a temporary. We can refer them to low-cost medical options with other organizations in town. And so allowing us the opportunity to work with them a little bit and schedule that intake will hopefully prevent them from having to give up their pet.
I've heard various theories about this being a college town, and I think some people assume that when the semester changes that there must be a big uptick in owner surrenders, students leaving town that don't want their pets anymore. Is that myth, or is that reality?
That's myth. Sure, it's a college town, and there are some situations where college students leave their animals behind, abandon them, but I don't think it's at any greater percentage than the general population. And the other thing that sort of people don't realize is the positive effect of the college students on the animal welfare community. The PetSmart at Butler Plaza is the #1 adopting PetSmart in the country for about 5 or 6 years running.
Really?
And it's because we have that, or my theory anyway, is that we have that renewable resource of college students who adopt and then move away and take their pet with them. Not a few years ago, I was one such college student in this town, and, you know, took my dog back home with me where he lived for many years.
So you went to college in Florida and Georgia, huh?
That's right.
What a mixed up human being you must be. I think another myth is a lot of people who adopt pets bring them back with some great frequency, but I understand it's not really that large a number.
Yeah, it accounts for about 1 or 2% of our intakes annually, so not very much, very many at all. And you know, sometimes it's just not a good fit. Maybe the dog was too active for apartment living, or occasionally you might get the opposite, where the dog was kind of a couch potato and the person was very active. So you know, we try very hard to match up the sort of you know, demeanor or behavior of the animal with the personality or with the lifestyle of the adopter as best we can.
Talk to me about your field operations team. What percentage do they bring in, and under what circumstances do they bring in strays?
About 45% of our intakes overall come from the field operations team. 40 of those percentage points being strays and about 5 being owner surrenders. A lot of times they'll get in the field and we're called out to do a welfare check on an animal or something like that, and they find that it's not being well cared for, and in the process of conversation with the owner, they just decide to go ahead and surrender the animal. So that happens, and oftentimes it's in the best interest of the animal to go ahead and take that one and get it out of a bad situation.
And that's typically a voluntary situation?
Yes, yes.
Yeah.
We're not twisting anybody's arm, but certainly that's an option. A lot of times the officers are going out and the animal, it's been reported to us that the animal's not being kept in the best of conditions, and so they just go out and try to have a conversation with them and see if there's some way that we can assist them and educate them and hopefully get them to be a better, more responsible pet owner. And sometimes that works and sometimes it doesn't.
Right. What is the total number of pets in the last, let's say, year or so? And what is the trend like last 10 or 20 years?
It's last year we took in right around 4,600 cats and dogs. And that's down from around 11,000 at the turn of the century in 2000. Yeah, so 18 years ago. There has been a really big, was a concerted effort. Maddie's Fund came in and gave a lot of, or poured a lot of money into this community to try to help us become a no-kill or a high live release rate community. And so since I think the baseline year for that was 2000, and so we're tracking a lot of numbers. When you see our reports on our website, you'll see the numbers, both the current numbers and compare that with the baseline numbers from 2000. Maddie's Fund came in, they incentivized a lot of rescue groups and other animal welfare organizations to pull animals from us to take them as transfers, and they got a little stipend every time they pulled an animal, and depending on its condition they got maybe more or less. So if it was an animal that needed a lot of work, like maybe a dog that needed heartworm treatment, they got a larger stipend than they did for a healthy young puppy. But in the end, it really helped this community to rally around animal services and come together to try to increase our live release rate over those years.
We could certainly do a whole program on Maddie's Fund, and I know that funding is no longer around, but I know it was instrumental in helping our animal services operation.
Absolutely.
Can you kind of walk us through what is the process, whether it's a field officer bringing in or a over-the-counter surrender? What happens to that animal in the shelter process?
Absolutely. At the shelter, both at the shelter and in the officers' vehicles, they all have microchip scanners. So hopefully the first thing that's being done is, securing the animal and then scanning it for a microchip. And officers are also equipped with laptop computers now that are connected to our database. So they could conceivably scan the dog or cat for a microchip right there on the spot in the field, step into their truck and punch it into the computer, and hopefully If everything works just like it's supposed to, they get contact information for the owner, and they're able to ring them up and say, hey, we found your dog over on such and such a street, and do you still live at so-and-so address, and then take it right back over to them.
So it never makes it to the shelter in that case?
In a perfect world, yes. What we frequently find, and what I would love to sort of caution people about, is if your animal has a microchip, please, please, please make sure that you keep the information up to date. The microchip is simply, it's about the size of a grain of rice, and it's embedded under between the shoulder blades, right under the skin. And when we run our scanner across it, all we get is a 16-digit number. It's not all your information, it's not your address and all that. So we get that 16-digit number that then we know the manufacturer of the chip and we know the number of the chip, and that enables us to contact the company that manufactured the chip, unless we have you in our system, from where you had it implanted at Animal Services. So we contact the microchip company, and that information is only as good as you make it. So if it was 3 addresses ago and 2 cell phone numbers ago, it's going to be very, very hard for us to get in contact with you.
Gotcha, gotcha.
So that's important. But
now these aren't GPS devices, right?
No. And funny story, every now and then we do get a telephone call from a citizen who says, I've lost my dog, and could you please call it up on your computers and tell me where it's located? And I'm so sorry, but it doesn't work that way. We have to be about this far away from the chip with the scanner. So. But yeah, after scanning for the microchip and looking for other signs of owner identification, like perhaps a rabies tag or a license tag or something like that, we can also trace those numbers in our system. Then it would be vaccinated, dewormed, receives a series of preventatives for fleas and ticks and heartworms, basically internal and external parasites. Mm-hmm. It's photographed, it's posted on our website. Right now we're trying to get the actual strays posted on our website also, but for now there is a link from our website, myacas.org. There's a link from there to a website called Pet Harbor. And that's the website that's created by our software manufacturer, the software that we use. So you can go there and see instructions on how to look up and see if there's a photograph of your lost animal. We also, to the greatest extent possible, try to push it out on social media. Gainesville Pet Finder is an excellent resource, and then Animal Services also has its own Facebook page. Right. So we do those things. We do medical exams. We have a veterinarian and 3 veterinary technicians on staff. So they do full medical exams on each animal. They're looking for signs of illness and injury, and whether this animal is a good candidate for adoption, or whether it's a better candidate for transfer or rescue or something like that. Mm-hmm. And then, of course, it would be put in a kennel where our dedicated kennel staff come in 7 days a week, 365 days a year, to make sure that all the animals are well cared for.
And then when the owner reclaims the dog, what is the process there?
If it doesn't have one, it'll receive a microchip. We've started doing that in the past couple of years. We'll have to charge them for the intake vaccines. Everything that comes into the shelter gets vaccinated right away. We don't, a lot of people will say, well, my animal was already vaccinated. I vaccinated it a few months ago. Well, that's great, except Fluffy couldn't tell us that. So we have to assume that it wasn't vaccinated and do our due diligence and try to vaccinate it to protect its health and the health of the other animals in the shelter. So you're likely going to have to pay small fees. Each of our little items are only about $10 a piece, so $10 for intake vaccines, $10 for dewormer, $10 for microchip, $10 for a rabies vaccine if it hasn't had one in the past year. And then we charge $10 a night per night for boarding, in the hopes that we encourage the owners to come and reclaim them sooner rather than later. But you get your pet back in better condition than when it left your house. A lot of people, occasionally someone will say that to us. They had a $50 or $60 reclaim fee, but it was cheaper than a visit to the veterinarian, and they got all the very same things. So, not that we're trying to compete, but that's a nice benefit. So let's say there's no reclaim. Tell me about the process.
if you can kind of give that to me. I wish I had 2 hours with you, but kind of walk us through quickly what happens if an animal is not reclaimed.
Well, there's different stray hold periods. There's 2 different stray hold periods. It's 3 shelter business days if the animal has no owner identifying information, and it's 5 shelter business days if it does have owner identifying information. So if it has a tag, a tattoo, or a microchip, you're looking at 5 shelter business days. After that point, it becomes the property of Animal Services, and if we feel like the animal is a candidate for adoption or a candidate for transfer to one of the other groups, we will usually sterilize it, treat it for any common ailments, up to and including heartworm treatment. And like I said, we could place it for adoption, we could put it in foster care if perhaps it needs heartworm treatment or something like that. And then we could also transfer it to one of our coalition partners.
Let's give a shout out to them. Who are your partners, Ed?
Biggest one is probably Humane Society of North Central Florida. That represents actually in the 2.5 years that I've been here, a couple other groups that are up under that, like formerly Gainesville Pet Rescue and some others. Puppy Hill Farm, also a big help. Hell's Angels, Faithful Friends, Second Chance, Plenty of Pits, and a whole host of other ones that are too numerous to mention. So,
let's switch gears a little bit and talk about feral cats, cats that are outdoors. I know we have a kind of a return to the field policy, and that's county commission board policy. Sometimes I think people don't quite understand that a cat gets taken to the shelter and then it comes back to their neighborhood. Tell us how that works.
Well, you know, Mark, Animal Services all across the country had been doing it one way for many, many years, decades in fact, and had euthanized a lot of cats. The old way of doing it was to pick up the cats, and if nobody wanted them, then you would just simply euthanize them. And if you look back at our numbers from 2000, you will find out that we were euthanizing thousands of cats every year. It's, you know, pretty bad from a moral standpoint. It's pretty dampening to the morale of Animal Services employees. I don't think anybody goes to work in an animal shelter because they get to euthanize, you know, thousands of animals every year. So a better way that a lot of communities, Jacksonville is a shining example, over the past several years have taken is to do what we call a return to field program. If you have a community cat that's been wandering around, it's maybe indoor, outdoor, or primarily outdoor, comes into the shelter and you put it in a metal cage, no matter how nice we try to make that cage or how many portals we put in it or whatever, they tend to get stressed and they tend to get sick. And then you create this sort of never-ending cycle of you have you have rooms full of sick cats. You're not able to do sterilization surgeries on them. Typically, the national average for reclaiming cats in a shelter is less than 2%. You know, if you think about it, a lot of indoor-outdoor cats, they may just sort of disappear for a week at a time and nobody really thinks anything about it. So maybe a couple of weeks before somebody actually comes to the shelter to look for their missing cat.
Right.
And by then at a shelter, it's oftentimes too late.
Yeah.
So actually one of the local experts here, Dr. Julie Levy over at the University of Florida, that's famous for creating the Operation Catnip program, both here and up in North Carolina as well. She says that in her research, cats are 13 times more likely to find their way back home if you just put them back where you found them. They're not necessarily lost. They may be going over to Miss Smith's house for breakfast, and Miss Jones' house for lunch, and Mr. You know, so-and-so's house for dinner. So
it's a movable feast.
That's right. So it's whoever has the, you know, the best food at the time. So what we do is we, with approval from the county commission, we created a 0 stray hold period for cats that don't have owner identifying information for the purposes of a live outcome, not for the purposes of euthanasia, but for the purposes of a live outcome. And so we simply, you know, in a good situation, it comes in on day 1, day 2 it's sterilized, vaccinated, and ear-tipped, and day 3 it's put back where it came from.
So Ed, I know in talking to you that there are some common misconceptions about community cats or feral cats. What are they?
Well, common misconception is that they're not very healthy and that oftentimes they're sick or, you know, they're disease riddled or something like that. And numerous studies have shown that that's really not the case, that they're just as healthy, sometimes even more so than house cats are.
Interesting. So let's pull it all together and talk about your outcome statistics.
Mm-hmm.
What happens with these animals and what are the outcomes?
Well, good news, in the past couple of years actually, we've had really high live release rate. We finally accomplished that goal of no kill that we were working for so many years for. Adoptions directly from animal services make up about 40% of our outcomes.
Wow.
Transfers to the local coalition partners that I mentioned earlier make up about 25% of those outcomes. Transfers to some of the other local rescues, or some of the other rescues, I should say, local, breed-specific, some out of town, about 3%. And then the return to field program for cats only has made up about 12% in the past couple of years of our outcomes. And then owner reclaims vary from year to year, but usually hover somewhere around 12 to 15%. And then we try to make sure that humane euthanasia is less than 10%.
And that's kind of the gold standard for no kill?
The gold standard for no kill is that we're trying to reach 90% or greater live release rate. And in 2017, we reached it for the first time ever at 93%, and then in 2018, we hit right at about 90%.
Right. I'm sure it varies greatly year to year. You never know what you're going to be facing. Just in the last minute or so, are there any final things that you would like to leave our audience with?
Yeah, would love just to reiterate, please, if you find a stray animal, unless it's injured, please don't take it to the veterinary practices. Try your best to bring it to animal services if you can. If you can hold it overnight and then bring it in the next day, that's awesome. If you can't, or it's an emergency situation, then certainly call and one of our officers will respond. Please avoid taking nursing kittens away from their mothers because they're way better off with them. And please don't leave dogs in hot cars.
Thanks for joining us, Ed.
Thank you.
Dogs can't flush, so wherever they do their business, scoop the poop, bag it, and trash it. Clean creeks, clean yards, clean paws. A message from the Gainesville Clean Water Partnership.
We used to write letters to each other a lot. A lot of the notes, they were just really dark.
Expressions of anger. When he was mad, he hit things.
Said something to me about killing himself.
You have to take it seriously. The risk is too great.
You have to try and help them get help.
Tell somebody, tell an adult, counselor, parent, whatever.
What are you going to do? Let them destroy themselves? I don't see much of a choice at all.